On behalf of the board and staff of the foundation, I welcome you to this conference, Developing a Patient-Centered Medical Home Workforce in Connecticut. Thank you to Dr. Ball for the university's hospitality, and thank you to the Lieutenant Governor for your continued leadership on healthcare reform in Connecticut. The Universal Healthcare Foundation has worked over the past 12 years toward its mission of achieving access to quality and affordable health care for every resident of our state. We believe health care is a fundamental human right and that securing universal health care is part of the quest for social and economic justice. Working with our many partners, among them the Allied Health Workforce Policy Board, which I co-chair along with Stuart Rosenberg from the St. Francis Hospital. Working with our many partners, we've achieved great strides toward this mission. Connecticut has made strong progress, and we still have a long way to go. The foundation remains committed to transformation in healthcare reform, transformative healthcare reform that works on the root causes of the troubles in our system of healthcare delivery and financing. Healthcare in our state represents a significant part of the state economy, both in the public and private sectors, with state spending alone nearing 10% of the budget in the 2012-2013 fiscal year. The healthcare sector also continues to create jobs. Connecticut labor market figures in September showed the healthcare and social assistance sector adding the bulk of jobs that were created and leading all industry sectors in job growth. Clearly, the health sector is an important part of any plan to boost job growth in Connecticut and a contributor to economic recovery. Affordable health care is also critical to business. Health insurance costs in Connecticut are among the highest in the country and pose a major impediment to businesses' ability to grow and to attract and keep employees. If we want better health outcomes for the dollars spent, healthcare reform presents an opportunity for Connecticut to prepare the workforce needed. The primary care patient-centered medical home is a term we've come to hear frequently in the context of health reform. Much stock is being placed on the ability of the medical home to improve the quality of care, to help people stay healthy, prevent complications of illness, and ultimately contribute to reduced costs. There are a number of efforts underway in Connecticut to expand primary care medical home capacity. ProHealth Physicians, Connecticut's largest primary care physician organization, and Community Health Centers, Inc., the largest federally qualified health center in our state, have achieved national certification as primary care medical homes, patient-centered, I should say, medical homes. The Connecticut State Medical Society, the CSMS Independent Practice Association, and Qualidigm are collaborating to assist 25 additional physician groups achieve such certification. The Community Health Centers Association of Connecticut is working to support its members achieve PCMH certification. To create a robust system of medical homes in Connecticut, the workforce, those already employed in healthcare, and those yet to come, must be skilled in coordination and transitions of care, patient engagement, community outreach, team-based practice, chronic illness management, information technology, and quality improvement. This is why we are here today. While we often hear the alarm sounded that there are not enough primary care providers to take care of everyone covered through reform, how to actually develop the workforce we need or will need is an issue that has not received a lot of attention to date. The goal of this conference is to build concrete strategies for developing the workforce needed to transform healthcare delivery in Connecticut. To do this, we will focus our attention on the challenges of training and supporting interdisciplinary teams, using a public health lens to consider the need to link the medical home to the rest of the community, and we'll learn about public and private initiatives to promote primary care medical home in, primary care medical home workforce development here in Connecticut and also in Rhode Island, Massachusetts, and Pennsylvania. We have a chock-full day in store for you, so get ready to listen, think, and discuss. To start us off, I am pleased to introduce to you our keynote speaker, Dr. Jeffrey Borkin. Dr. Borkin is professor and chair of family medicine at the Alpert Medical School at Brown University and will speak to us this morning on the challenges and solutions he sees to developing a patient-centered medical home workforce. Please join me in welcoming Dr. Borkin.